Hi everyone. Hi. All right. So today I'll be sharing with you on the 5 things that you should know about celiac disease. So I'm Jasmine from EMW, Gut and Moxa. I'm a TCM physician, and my area of interest lies in gut health, optimizing your body second big brain through TCM holistic approach. So without further ado, let's start our session today. So what is celiac disease? Let me just move on to this. Okay, celiac disease is actually an autoimmune disorder that causes the inflammation and destruction of the small intestine upon trigger by ingestion of gluten, which is found in wheat, rye, and barley. And people with underlying conditions such as type 1 diabetes, other autoimmune thyroid disease, or chromosomal disorders such as Down syndrome, Turner syndrome are at increased risk of getting this celiac disease. As it causes damages to the small intestine, it is also known as the bilious atrophy. So you can look at the picture on the left. When there is bilious atrophy, it means that the small intestine, the bilious actually gets shorter, and this actually affects the absorption of nutrients in the body. So it actually causes malabsorption of nutrients, and when this happens, it causes a deficiency of your micronutrients, your macronutrients in the body, and it causes deficiency like iron, folate, which actually would in turn affect, for example, like increased risk of osteoporosis, of anemia, etc. So because these patients, there isn't any specific or a good solution treatment to it, they have to follow a strict gluten-free diet. And this condition can also be passed down genetically. It affects both children and adults, much more in females than males. So there are 4 different categories of celiac disease. The common one would be classical, followed by like non-classical, silent, and refractory celiac disease. So we'll go more to each of the following to know what are the differences and the signs that you can actually look out for. So for classic celiac disease, there would be obvious symptoms of malabsorption. For example, there would also be like fatty stools, symptoms with the gut, diarrhea, and also weight loss, especially true for children, and also the lack of growth in children. Because the gut health is affected to a certain degree, for example, like the nutrients uptake, the nourishment to the body, it is being affected. For the non-classical celiac disease, there would be mild symptoms of gastrointestinal symptoms, for example, abdominal distension and pain, chronic fatigue. So because we do mention that there would be loss in proper nutrients absorption, and because there would be the lack of like iron, folate, the essential vitamins and minerals, then you would also probably feel that there would be anemia. There would also be pain, joint pain, muscle pain, difficulty in losing weight, and for women, there may be changes to your menstrual cycle. There may be a cause to why it is like having unexplained infertility. Moving on, the next one is the silent celiac disease. It is also known as asymptomatic celiac disease, which means there may be no complaints of any symptoms, but if let's say they go for a check, they can actually notice that there would be the small intestine damage, the bilious atrophy, when they undergo like endoscopy or biopsy to it. if let's say they decide to go on a gluten-free diet, then there would be better health and also like reduction of acid reflux or abdominal bloating per se. So this is actually dangerous because it is silent. It means it's probably the bottom of the iceberg, where we wouldn't probably rectify anything unless a test is being done. The last is the refractory celiac disease. This is probably the most severe form where there will be persistent and recurrent of malabsorption symptoms and the bilious atrophy, the damages to the small intestine, despite having a strict gluten-free diet for the past 6 to 12 months. That means even though with strict gluten-free diet, you are not able to see obvious improvement nor a reduction in the discomfort symptoms. So if left untreated, this is dangerous as it can lead to like type 1 diabetes, other complications, cardiovasculars, okay, and potentially fatal. So like I mentioned earlier on, for celiac disease, there will be signs and symptoms both affecting the digestive, your gut health portion, and also the non-digestive portion. So for the digestive portion, what are the symptoms that you may be feeling from time to time, or it may worsen when you have a gluten diet? It is actually like stomach bloating, pain, you feel that there is a lot of pressure in your abdomen. For your bowel movements, is either a constipation or diarrhea with pale colored stool, and it's very foul smelling as well. And because of the lack of good and proper nutrients absorption to nourish, to replenish, to rejuvenate our body, there would be that fatigue, that lack of energy despite having good rest. Okay, and there may be weight loss, nauseous and vomiting. For the non-digestive part, likewise, because of the damages to the small intestine, you may also experience like anemia, the iron deficiency, the loss of bone density, the osteoporosis, your calcium, your vitamin D may take into place. So for the non-digestive part, you may also see that there may be skin rash, itchy, blistery, and that is not caused by virus, but actually because of this celiac autoimmune disease. So do you notice it's pretty interesting to actually find the connection when you have skin rash with digestive disorder? Okay, so in TCM, right, because the skin, it is governed both by the lungs and also your spleen. So the spleen actually is the main digestive organ. So if let's say the digestive organ is not well done, it is not efficient in carrying out its functions and duties, then yes, in the long run, it's not going to affect just on the digestive system itself, but it's also going to affect on the connecting organs and the representations on like your skin. So headaches, fatigue, also nerve pain, numbness or tingling sensation to the feet and hands, joint pains. So what can be done to actually know that you have celiac disease is that when you have recurrent symptoms prolonged for 3 to 6 months, even though let's say you have been eating very clean, then you may need to consider to do the test. This would be actually advised by your doctors. So the test involve basically these 3. There could be more, but this will be the rough guideline and introduction. So in the blood test, we would be finding out if there is positive indications of your antibodies, as shown, your IgG, IgA. So these are actually immunoglobulins. They are known as the antibodies that actually recognize and being triggered upon a immune response to fight against inflammation in the body as well. So then you also would have the biopsy, the endoscopy being done to look at how your small intestine is. And remember when in the first slide when I mentioned that it may be passed down genetically. So genetic tests can be done to actually rule out for genetic passed down celiac disease as well. So for example, if let's say you have your blood test and your biopsy done, if let's say both are positive blood tests with the antibodies elevation, the presence of the white blood cells in the body fighting for inflammation, and also the damages to the small intestine, then yes, you will be advised to have a strict gluten-free diet. If not, then there will be other consideration and other factors. They may be very similar to celiac disease, but it's actually not. So on your side, what can you do? What can you eat? So the first and foremost is really to stick on a gluten-free diet. That means there is no wheat, barley, and whey. And per se, for most of us, for people who love their breads, you may have to really look out for these keywords. And then please, no beer. So on this picture here on the right, on the red color portion, the stop, it's actually the food items that you need to be aware of and to stop having it. You can then have much more of what we call the anti-inflammatory diet, because there is actually inflammation in your body, especially in your small intestine. So you may want to go with nuts and seeds. You want to go with your lean proteins, your good proteins, and healthy fats. Yeah, so these are the choices to have. Rice is actually okay. Cooked rice is actually okay, but in moderation. So I would always fall back to complex carbohydrates, lean proteins, and healthy fats. Okay, and the cautions in the yellow, please have, if let's say you want to have sauces, please make sure that you know what is in the sauces. The safest choice to go is actually to do homemade sauces. And then your sweets, your chocolates, please have it in moderation as well. And because when we say that your body is inflamed, fighting inflammation, there's actually stress in the physical body. So what we want to manage that stress in that physical body is actually to do some breathing exercises, some stretches to release the tension in our body as well, and to mentally feel better and at ease. So what you can do is to practice in yoga with mindful breathing, and also to find time to work out. For example, you can do some brisk walking, moderate intensity exercise. You don't have to go intense, but the thing is to have the routine to do it on a probably twice a week basis, each time at 20 to 30 minutes. Yep, so this is what you can do. And then from a TCM perspective, what do we actually know and say about celiac disease is this. We do have the 5 main organs and their functions in the body. So for celiac disease especially, it would be under a spleen qi deficiency. And when there is prolonged spleen qi deficiency, it's actually going to affect and cause more dampness accumulation in the body. So it's going to be linked for the point 1 and point 2. So looking at point 1 right now, under the spleen qi deficiency, it is actually caused by overexertion. That means tired, burnout, okay? And then you are not probably eating properly, eating well with, in terms of with your food selection, and also the timing, whether you choose to practice mindful eating, like what I've mentioned in our previous IBS talk. So when we are not focusing on how well we eat, it's going to affect both the physical and the mental. So the symptoms presentations would be like poor appetite, you don't have the desire to eat, there will be weakness in your limbs because the spleen governs the muscles as well. So when there isn't a good spleen movements in the and function in the body, it actually causes weakness to the muscles as well. Fatigue, abdominal cramps, loose stool, pale complexion. So if let's say if you want to look at your tongue right now, if you have your phone with you, you can switch it to your selfie mode, stick out your tongue nicely like this. And then you can see the color of the tongue to be a bit more pale in color. There may be a coating above. And then because of that coating, if let's say it is very thick, that means there will be accumulated dampness and it covers the base color of your tongue. So your tongue actually tells you a very good indication of how your body is. And especially when there is spleen Qi deficiency, there would be also obvious teeth marks. That means your tongue actually looks fatter than it is. Yes, and then there would be that teeth, that very jagged outline of your tongue as well. Okay, so moving on, like I say, if prolonged Qi deficiency, spleen Qi deficiency in the body, there would also be accumulated dampness because the digestive function is not being carried out properly. So it affects both on the digestive system and the skin. So remember the connection of your lung, your spleen governing the skin. So what you would experience in terms of the symptoms would be like the swollen puppy eyes and heavy limbs because of the retention of this dampness. We call it the turbid fluid in the body. Indigestion, such as bloating, chest tightness, weight gain, because absorption of nutrients is not being done properly. Waste loss is also not being done properly. Sticky tools, sluggish energy, and then for the ladies, there may be like thick vaginal discharge, and the connection to the skin would be skin allergies such as hives, eczema. So when we say about the TCM constitution, we also would like to know what does small intestine do in the TCM perspective. So the digestive organs in both the bioscience perspective and TCM perspective, they both would govern a physical and mental role. Because of the intense study of like the brain-gut axis on how the connection between the brain and gut actually works to actually, they are interconnected and they actually affect each other. So for the mental role, because the small intestine pairs up with the heart, in the TCM terms, we call it 心与小肠相表里. So with this connection, the heart actually is the main, I would say, the chief in the whole body system. It actually would move in terms of having clear thoughts and judgment as well. So for the small intestine, it actually helps to govern in the mental role aspect, to clear thoughts from the turbid, from the dirty fluid per se, and to have clear judgment. For the physical role, it is actually to further participate in the digestion, to break down food sources into the clear essence of water and grain, which we call it 水谷精微. So this 水谷精微, the clear essence of the water and grain, is actually to be distributed to the whole body for nourishment. So when we have celiac disease, right, this is actually not being well done. There isn't the good achievement for this 水谷精微 in the body. So it's not just having this 水谷精微, it's also to actually have the turbid being sent downwards to the large intestine and to being passed out as urine and stool. So for digestive, it's always back to the basic of nutrients absorption and waste excretion. Okay, so from TCM treatment, where we have our acupuncture, moxibustion, and also herbs, what can be done to actually relieve the symptoms of celiac disease? So as we know, celiac disease is being caused by the inflammation in your intestine. So actually, like acupuncture, and Chinese medicine can relieve the discomfort that you're feeling. And this is a case study done in 2011. So with this, plus a strict adherence for the gluten-free diet, it would help to actually, on the right, relieve the skin condition in an undiagnosed or atypical, which is the non-classical celiac disease. So this is actually to minimize. What would be good is actually for us to help, especially in the classic and non-classic celiac disease patient. So how it works is that through acupuncture and moxibustion, we are able to encourage your rest and recovery system to take place, which is known as the parasympathetic system. Okay, so it helps to reduce inflammation in the intestinal linings. It helps to recover that portion and hopefully for the digestion function to work well again. So it reduces the anxiety as well. And moxibustion is actually a heat therapy with deeper penetration into the tissue layers with medicinal values. So what it can do is actually to enhance the removal of the dampness in the body and also to allow energy movements to work more effectively. So for the TCM herbs, likewise, it is able to reduce the discomfort symptoms such as abdominal bloating, digestive upsets, the alternating between constipation or diarrhea. And once we are done with regulating or to reduce this discomfort, we then comes to strengthening, to nourish these digestive organs, to strengthen your spleen function and to remove the dampness. And so for my clinic, because I do have a passion for essential oils as well, so I would actually recommend patients, or if they are also an oil user per se, to actually customize a oil blend, okay, for a tummy rub. Okay, so what you can use is the following, like lavender, fennel, ginger, and peppermint. So lavender is good because it has the calming and soothing, relaxing property. It helps to calm you down. And fennel and ginger works directly at the digestive to reduce the tension and bloating and to clear the stagnant energies at that localized area. And peppermint is actually to release any spasm. So with this, it is actually a 2% dilution. You can place it in a bottle and then blend these oils with a carrier oil and then apply it generously on your tummy and massage it in a clockwise direction gently. Or for example, what we can do next, which I would actually introduce you, is a acupressure point that you can find, which is known as the Guan Yuan CV4 acupoint. How you locate this point is actually 4 fingers down from your neighbor point. So your neighbor is here. So 4 fingers down, and then place it just directly at the midline. You can just feel that there is a acupressure point where you press in and release. This is actually a good way to massage this point. And why I would choose this point is because it is linked to our small intestine. And when we massage this point, we can actually practice mindful breathing as well. So if you are an oil user and if you like to do acupressure points massage, what you can do, pour your oil out, rub it on your hands, and then rub it on your tummy in clockwise direction, slowly, gently. After which, 4 fingers down from your navel, on the midline, find Guan Yuan point. When you breathe in through your tummy should balloon out and then you don't do any deep acupressure at this point now. Once you breathe out, when your stomach deflates, press, hold the point downwards and to the limit where you feel that you cannot go any further. Hold it there for 2 to 3 seconds before you let it out again. So when we are doing this, we are basically very mindful on how we breathe through our tummy, where we call this like abdominal breathing as well, because when we breathe right, when we breathe through our abdomen, one thing good is there would be more blood flow to your extremities, your hands, your limbs, and as compared to thoracic breathing, this is actually a breathing that can calm you down when you're feeling anxious or when you're feeling agitated as well. Okay, so this comes to the conclusion and the end of my talk. So some reminders that you may want to take home from my sharing today is that for celiac disease, if let's say you have been diagnosed, please just follow on a gluten-free diet. Watch out for any food triggers. If you like to have a food diary with you, if you need to just note down anything that you would find it causing much more discomfort after that particular meal. And then with gluten-free diet, also try to include anti-inflammatory. Basically, is to have much more dark green leafy vegetables, your citrus fruits, to actually have much more of what we call the micro nutrients, your vitamins and minerals, especially when you're having, certain form of like celiac disease, when there is deficiency in nutrients absorption. This would be helpful. Remember to head out to work out at least twice in a week for 20 to 30 minutes. Practice your abdominal breathing. You can do your acupressure massage with it, and to sleep by 11 p.m. every night for good rest, toxin removal, and your body recovery. So thank you all for listening in, and I hope to see you all again. But before I move on, let me see if there are any questions on the chat. Okay, please hold on for a while. Okay, I have some questions over here that if we can drink cold water if we have celiac disease. Okay, in TCM perspective, cold, what would you think of if it is being cold in nature is that energy stops moving, and then there would be stagnation to movements. Okay, so you imagine ice in freezer and ice on stove. So once you have heat, the ice melt. But if you continue to put it in freezer, it just keep it as a solid state. So likewise, for TCM perspective, we usually won't recommend patients to have cold drinks or cold raw food, because we are concerned about the circulation movement, the energy movements in the body. So we want to optimize it. When there is good circulation in the body, basically it means that your organs functions are carrying out their duties well. So when it is well done, there would be reduction in discomfort, symptoms, and pain. Okay, does keto helps with celiac disease? Okay, for keto diets, because this celiac disease, we have to actually have a very strong adherence to having gluten-free diet. So, and this gluten is actually caused by this protein known as like your wheat, your barley, and your whey. So if let's say you're having your keto diets, make sure to eliminate this wording if you see on your label, and to always look out for wording that is like gluten-free. Okay. Yep, so I think that's all for today. Thank you so much for tuning in.